thickness of the skin itself is about a centimeter, sometimes even more in some of these patients. आपको breathing भी difficulty है left side में.
So we are going to do radix augmentation, dorsal augmentation.
You're satisfied? Awesome. आप कितना इम्प्रूवमेंट चाहती हैं अभी? क्या क्या आपको करना है?
यहाँ पे ये सपोर्ट नहीं है।
हाँ, बिल्कुल नहीं है। ठीक है, प्रोजेक्शन लगा देंगे। और ये बहुत फैला हुआ है, सपोर्ट नहीं है। करेक्ट, ब्रीदिंग भी प्रॉब्लम है, वो भी कर देंगे। आपको पहले कभी सर्जरी हुआ है?
नहीं।
सेप्टोप्लास्टी कुछ भी नहीं हुआ अभी तक। वेरी गुड. You have allergic rhinitis, so that may not improve with this. Okay, that might remain the same. All these things we can continue.
प्रॉब्लम तो नहीं है ना?
कुछ प्रॉब्लम नहीं होगा.
Like sinus problem.
साइनस है प्रॉब्लम, but that will not bother about it. हम तो सिर्फ नाक का करेंगे अभी. Septum also will do.
अभी एक्चुअली मेरे कफिंग का भी हो रहा है
ठंडा पानी में. वो आपका एलर्जी के साथ रिलेटेड है ना डॉक्टर, तो वो इतना सही नहीं हो पाएगा हमारे सर्जरी से. आपका नेजल ब्रीदिंग इम्प्रूव होगा, शेप इम्प्रूव होगा, एलर्जी ज़्यादा इम्प्रूवमेंट नहीं होगा. And it will come all the way like that. And this will also come little bit forward and this will go down. Narrow. Yeah. Your main work is the augmentation on top and the breathing issues that you're having.
Everyone, greetings from Richardson Hospital. Here we are with our pre-op patient. Today she is scheduled for a nose surgery and in specific being a rhinoplasty. So she is having both functional issues and cosmetic issues. Functional issue being she is having breathing difficulty from the right nostril, and cosmetically, if you see on the side view, her nose, she has a very depressed dorsum. She doesn't have a dorsum at all. So we are going to do radix augmentation, dorsal augmentation. Also, she has a very bulbous tip. We are going to give her a sharp tip, and the alar base, if you see carefully, it is flared. So we are going to do bilateral alar plasty. So overall, it's going to be radix and dorsal augmentation, tip plasty, then alar plasty. So this whole procedure is going to be a open structure septorhinoplasty with rib grafting. Procedure should take us over 2 hours, and she should be back here in the ICU with the desired nose. And don't worry about anything. Now we're going to prep her up for surgery, and we're going to start the surgery in some time. Thank you.
Cosmetic nose job. So we had to do a lot of work to get the nose into this shape, and we've still not managed to get a very sharp tip. The skin is more than 1.5 centimeters in thickness, and that's the main reason. We're going to show you the different views now. And once we show you the different views, then we're going to show you how the patient looked before we started. Okay, now let me show you how the patient looked before. So you see that improvement, it's dramatic improvement. So the nasal bones literally not existing and super thick South Indian, South Asian type of skin. All right, now the room side view. And again in this you can see the improvement. So you can see the huge improvement. एक मिनट आपको मिरर लेके आएंगे अभी. तो देखो काफी इम्प्रूवमेंट हुआ है. यहाँ पे भी रिडक्शन हुआ है. आपकी साइड व्यू देखिए, है ना, एकदम शार्प और एकदम स्लिम नहीं हुआ है बिकॉज आपका स्किन बहुत थिक था, बहुत थिक है. तो जितना हो चुका है यहाँ से देखिए, ऊपर से नीचे से, तो मतलब बहुत इम्प्रूवमेंट हुआ है. लेकिन एकदम पॉइंटी नोज मैंने बताया ना आपको, वो तो मुश्किल होगा, पहले बताया था. अब तो अभी देखो इसमें आपका नाक का लंबाई भी हुआ है. पहले कैसे था देखो, बिल्कुल फ्लैट और ऐसा बड़ा था. तो अभी थोड़ा प्रोपोर्शन किया है और आपके फेस काफी राउंड है, तो उसके लिए ये सूट ही होगा. और अभी सूजन भी है तो थोड़ा भी और कम होगा, बस ज्यादा नहीं. You're satisfied? Awesome. I would have been happy if the result was even better, but it was hard. Yeah, because the skin was very tight and very thick, so we couldn't manipulate it more than what we could achieve for you. There will be a significant improvement. The result's not going to be like wow, but good. It's wow. So sweet of you. Thank you. Are you having pain from the little bit is there
Activity.
now also, or you had little bit in the beginning?
In the beginning, it was not there.
Okay.
After 2-3 days started.
Okay. All right. So what we've done for her is a typical thick skin, sebaceous skin nose job. These are more challenging because the thickness of the skin itself is about a centimeter, sometimes even more in some of these patients, and there is a mismatch between the bony part of the nose on the cartilaginous part and also the soft tissue. So I try to get the bony part there where it should belong. We do a lot of soft tissue work, but still, because the thickness of the skin is a lot, it's very hard sometimes to get a perfect sharp nose. As you can see, we can get good improvements, and we can improve the proportion of the nose as well. Most importantly, that is from the radix till the tip, and create a balance and create a nose that's more suiting the face. Anyway, there's nothing like a perfect nose, and so you're just looking at augmenting that facial aesthetics. And if you look at the side view, you can appreciate what I'm saying significantly, especially this view. And so you see, it was like a stubby nose and short and broad. And so now it's become more proportional to her face in terms of the various subunits of the nose as well. All right, we had to harvest ribs, so generally that takes a little longer for healing, but then she's doing well. Take care.
Thank you, doctor.
Pleasure.